I would like to invite Dr. Sanket Mehta sir, a renowned senior cancer surgeon from SSO, Mumbai. He has 21 years of experience in this field. One of the India's leading experts in cytoreductive surgery and HIPEC with a major focus on advanced gastrointestinal, hepatobiliary, ovarian and peritoneal surface cancers. is his brain mind. He is currently the president of Society of Peritoneal Surface Oncology of India. His other areas of focus are image guided liver surgery for advanced liver metastasis, retroperitoneal tumor, and hepatobiliary surgery. Sir, please come on the stage to share few words with us. Everyone, please give them big round of applause.
Thank you so much for having me today. I would like to thank Rajendra Bhai, Avdut Bhai, SAL Hospital for inviting me. And it's really heartening to see such a big audience. The only unfortunate thing is that I'm not very good at speaking Gujarati, so you'll have to bear me in English. And today I'm going to talk about early detection. I think Dr. Jala has already covered everything, but I'll maybe focus on why early detection is important. And everybody knows this. Most cancers are treatable or curable if detected early. How do we address this problem? Because most cancers, in fact, are not detected early. And the reason why this is important is because of these statistics. We are going to see 14 lakh new patients next year in our country. Almost 9 lakh people die because of cancer every year. It is detected in late stage in more than 70% of the patients. And, the good care and good treatment can double the survival of the patients. Just focusing on Gujarat, 80,000 new patients every year. Majority of these, again, will be advanced cancers. Commonest cancer in Gujarat is, of course, oral cavity cancer. Gujarat is the capital of oral cavity cancer of the country. Unfortunately, I'm not the expert in that, so I'm not going to address that. But that does not mean that other cancers don't happen. We do have breast and cervical cancer as the next most commonest, followed by GI cancers, which is actually my area of specialty. But what exactly is cancer? Cancer is not one disease. It is a multitude of diseases. Our body is made up of trillions of of cells. And if I compare this to AI, where there are trillions of tokens which are analyzed and kept under control, and then you get an output, in our body, our genetic makeup controls all of this through our immune surveillance system. And when the immune surveillance fails, when it cannot detect a foreign or a unnatural cell as unnatural, that's when these cells multiply and form cancer. Now, this can happen from several different parts of the body. So you have several different organs which are affected. You have the hematological cancers, which are through the blood. We also have in each organ several different types of cancers with several different behaviors. So it is not one disease type. There are several thousand disease types which we are dealing with, and that's why the whole complexity of different treatments at different stages, along with different therapies. Our job as surgeons is much simpler. We have to cut out the disease part while preserving maximum function. I think it is much more complicated for the medical oncologist who have to remember these really funny names and doses to ensure that you get the right treatment. And you will hear from them after me. So again, the common types are these. And if if you realize that apart from oral cavity and perhaps some lung cancers, majority of the cancers do not have environmental factors which are directly attributable. In fact, if I talk about my specialty, which is GI cancers, only 10% of the patients have some environmental exposure which leads to a cancer. The rest are just de novo. What are the risk factors? Risk factors, Dr. Jala has already spoken about, but the most important things that are in our hands is to avoid addictions like alcohol or smoking, and the silent epidemic in our country, which is obesity. Obesity predisposes to cancers of several different organs, including breast, ovarian, endometrial cancer, GI cancers, colon cancer, pancreatic cancer, liver cancer, etc. And it is something that is in our hands to control. I'm not going to skip these few slides because I guess everybody has read enough of this in the newspapers. The one thing that I want everybody to focus on, and I think Dr. Jala already spoke about it, is any new symptom, any new process in your body which you cannot relieve with 15 days of medication is something that deserves attention and deserves a potential diagnosis of a cancer. It can be a GI upset, it can be weakness, it can be fevers, night sweats, it can be ulcer. Whatever it is that does not get relieved within 15 days is potentially a cancer and needs attention for that. The diagnosis involves a thorough process which includes a clinical examination, biopsies, scans, and each investigation gives a different information, which is why we insist on multiple investigations. Early diagnosis definitely saves lives, and it is extremely important that we do not ignore these symptoms. In our OPD, we find patients who come with symptoms which are there for 1 year, 1.5 years. They have bleeding in their stools for 1 year and they have not seek medical help. Or they have been advised a colonoscopy, but they don't do it because they think that the doctor is trying to gain profit. It's not so. Doctor always wants the best for the patient, and it is important that you listen to the advice of the doctor. The treatment is also just as complicated as the disease. We have surgery, medical oncology, radiation oncology, and all the ancillary services like state of the art, the pathology, radio diagnosis, which has to support to get the right diagnosis, the staging, as well as the treatment. I'll focus mainly on this part, which is surgery. And surgery is now not just one surgeon doing all organs. The days are gone when a general surgical oncologist would address all the cancers from head to toe. Just think about it. If you had to go to a local shop which repairs bicycles, cars, would you take your BMW, your most precious possession, to that person to repair? Of course not. The reason is that he will not have the aptitude to do it. And the same applies for cancer treatment. You cannot have a general surgical oncologist addressing every single organ in the body. It does not work that way. The reason is there is something called as the learning curve. You have a certain number that you need to do to get the skill to do it proficiently. For example, the average learning curve for a simple colon cancer surgery is 90 cases. That means that if I'm seeing all types of cancers, I'll probably see 10 colon cancer patients in 1 year, which means that I'll take one whole decade to overcome my learning curve so that I can give predictable results for my patients. Now, would you go to such a surgeon to get your treatment done? And what if I am a GI surgeon? Would you like to come to me to get your oral cavity done or a breast cancer done? Obviously, I will not do a good job, even though my training is for all organs. And that is an important differentiating factor that we need to remember. If there is one take home message from my talk today, it is that organ specific approach is the way to go in cancer surgery. Of course, we have chemotherapy and we have the best medical oncologist speaking after me. So I will quickly go to the next slides. This is the new kid on the block, immunotherapy and CAR T cells, which are more advanced therapies, very expensive, but yielding some unpredictable results and making these complex diseases like chronic diseases. And of course, our medical oncologists will talk about that. Once again, I will just leave you with this thought that specialization is important. It is not just good enough to have surgical oncologist. You have to seek out who is a breast surgical oncologist. That which has done the best numbers. So how do you judge which is the best team for you? You have to check what are the proficiencies that they have. What are they known for? Do they do minimal invasive surgery, which are keyhole surgeries, where you have cancers within the abdomen or the thorax, the chest? which can be approached by a small camera and long instrument so that you don't have a big cut and you recover fast. You have robotic surgery where you combine the precision of AI and very advanced robotic systems to deliver even better results. You have various other technological advances which are used to ensure that you have the best outcomes. And for that, you need to check whether the surgeon has a specialization that you are looking for, whether the volume of cases that he is doing is adequate, whether he's working in a team approach. Because once again, if you have one surgeon doing everything, he is not good enough. And what is the communication? What is his online presence? What publications is he doing? Is he doing any research in his field that tells you that he's a specialist in that field? All these things you need to check before you give yourself up for treatment with a doctor. Next slide. And that brings us probably to the question, why SAL Hospital? Imagine this auditorium currently has probably 500 people, which means that at least 50 people will be diagnosed with cancer at some point in their lifespan. That's the incidence. One in nine, every 9 individuals is going to get a cancer. So you need to go to the place where you have a team approach looking at all the different types of cancers to deliver the best results for you. And that is where SAL Hospital has taken this initiative and is working to build a team. And I wish all the best to SAL Hospital for doing that. Thank you very much.